So what are we talking about today? So we are talking about today cookie cut approach to your healthcare. So what do I mean by that? So what I mean by that is you're a cookie cut. So, there's a mold, you present with a particular symptom and you get put in that production line or this production line or this production line. So for example, you have knee pain and you have a scan and you need a knee replacement because the doctor has deemed that your cartilage is worn or something, and then you go and you get a knee replacement. There's only one surgeon that I know of up here on the Sunshine Coast who actually custom makes the knee replacement for you. Everybody else just takes it off the shelf. So do every single one of us have the same size knee, same bone density, same everything? No, we don't. So do you really want the same as everybody else? I also have worked with surgeons who have said to the patient when they've had complications post-operatively, oh, it can't be me. I've been doing the same thing for 25 years. So again, that person was cookie cut. This surgeon had done exactly the same thing for exactly the same people for 25 years. So that rings alarm bells to me to think, well, with all the medical advancements in the last 25 years, surely you would tweak your surgical technique. And B, not all of us are created equal or the same. So why would we want a cookie cut approach? So what is the paradigm shift that we need to make? Well, we need to start demanding from our healthcare professionals a personalized approach. Like, probably 5-10 years ago, bespoke furniture and bespoke coaching plans and bespoke everything became the latest trend because not everybody wants the same thing. So why can't we have bespoke healthcare? So, if a client comes to see me, we've talked about this before with lower back pain, for example. I don't rely on their scans. I listen to their story. I examine their body. And not one person presents with the same thing. So I don't treat them all the same. Not that I don't help them all in the same way. So what do we need to do? What shifts do we need to make? So you want someone to spend time with you. So clients come to see me in the clinic. The first time you see me, I'll spend an hour, up to an hour with you. The second time I see you, it's half an hour. Sometimes it goes back to an hour depending on what we're doing, if we're doing some movement classes. So what do we do in that hour? I listen. So the first time somebody comes into the clinic, we sit down, we go through their health history, but then we dive a bit deeper. We find out, where did they grow up? Did they grow up on a sheep farm and they were responsible for, doing stuff with sheep drinks ever since they were kids? Or, are they a little bit older, so got sprayed with DDT back in the day because that was what was done and now is known to be horrifically bad for you? Did they have any traumas growing up? What exactly is it about that person that makes up that person? So the only way you can find out that much information is to spend time with you. That's it. So, I haven't been to the doctor and I can't even remember how long. Probably since I broke my leg a couple of years ago. But you sit in their waiting room, they're never on time. Like never on time. And then you fly in, spend 5-10 minutes and then fly out again. Like what depth of care can you receive in that time? Not a lot. Even when I used to nurse in the hospitals, in the big tertiary hospitals, you could afford to spend some time with clients because you had patient ratios. So you didn't really have more than 4 patients. But when you go into the private sector, and sorry about the dog again, you go into the private sector, there are no ratios. So you can have one nurse looking after 8 patients. If you get busy or something goes wrong, you don't spend time with people at all. So, you need to find someone who will actually spend the time with you and listen. And then the other shift we need to make is, and we've talked about this before as well, stop treating the symptom. So knee pain is a symptom, back pain is a symptom, all pain is a symptom. So we want to find what is the cause of that symptom. When did it start? So, as ANF, when I started my ANF journey 5 years ago, I was blown away by the education that we received on how to actually examine the body, find the problem just by using my ears, my eyes, and my hands. So, people can come in here with their scan results and everything, and that's great. It gives me a really good idea. But if you've got a bulging disc, it doesn't actually mean that's the cause of your pain. Like I've said before, 50% of the people that walk in here with a scan that says bulging disc, the back is not the driver of their symptom. So you've really got to find someone who finds the source. So next time you go to the doctor and they say, oh, we're going to do this, ask why. It's your body, it's your health. Ask your health professionals why. Why do you think that? Can you explain to me the process? And the last shift we need to make is people actually need to physically assess you. Like you can't tell where the inflammation and the pain is everywhere in your body without touching you. It won't. Invisible inflammation is the #1 killer. It will not show up on scans. It will not show up on a blood test. The only way you can see is look at your eyes, feel with your hands, and listen to the person. So I hope you've learned something today. Please ask your health professionals the questions, because if you don't, they're not going to prompt it for you. You need to take a little bit of responsibility for your own health and start asking the questions. Stop accepting the fact that you, Mary, Bob, and Joe all got the same treatment for potentially 4 different reasons. And until next week, adios. Thank you.